Hello, and welcome to this week's episode of the Reset Podcast. I'm your host, Laura Munoz, CEO of the experience agency, D-Flash. Each week, I bring out a different leader from an interesting industry who's doing some game-changing work. This week's episode is no different. I'm super excited to have Adimika Arthur, who's the executive director of HealthTech for Medicaid. She's got an incredible company. It's an outstanding nonprofit and changing the way you can actually view healthcare. It's going to be a great conversation. Take a listen. Hi, Adimika.
Hello, Laura.
So glad to have you in from lovely San Francisco.
Yes, thank you.
And I'm sure weather is lovely or warmer than it is right here in New York right now.
Yeah, it's freezing.
I can't believe you're wearing short sleeves. What are you doing?
I have a jacket.
Do you not like yourself? Okay, fine. So you listen to the show, you know how it always goes. First question is always the same, and I'm fascinated by the answers. And I'm sure yours will be no different. So, Adimika, what's your first job?
Well, as a very good public health professional, my very first job was working at McDonald's.
Of course. And how old were you, and what did you do when you were working at McDonald's?
I was 15 and working at McDonald's, and I guess I say my first job, which is my first corporate America job, or my first paying job that was not, from church or from some sort of, community. I think I started working at 11, being a babysitter and a
child labor laws.
Child labor laws for sure. But McDonald's was my first job, and my favorite thing to do at that job was to work the drive-thru.
Really? You like dealing with people at the drive-thru?
Absolutely.
Why?
It was a way to, connect with people and try to challenge myself to get their orders right. And I love people. I think the complex nature of humans is very interesting. So I would always be fascinated with the people that never customize their order and the people that over-customize their order, like, fries with no salt. And I'm like, this is McDonald's. You realize that there always is some sort of salt in your fries.
How do you customize? Who does that?
People customize everything, honey.
You customize your Big Mac and add extra sauce and stuff?
They're like, I'd like a Big Mac with one patty instead of 3, and I'd like 3 pieces of extra bread plus no lettuce but extra sauce with onions but no pickles. Yeah.
Because that's how it works.
The world works like that, right?
Wow. Well, it's interesting. So you did learn how to deal with people, and you were definitely curious, and you were able to figure stuff out. So these are all tactics that come in very handy in what you do now.
Sure.
So where were you growing up in this McDonald's experience?
I grew up in Seattle, Washington.
Wow. So you've always been on the West Coast.
Well, no. I went to college in Atlanta and graduate school in Boston.
Gotcha.
Another graduate degree in the West Coast, but then yes.
Because why not have two? So you're at the Seattle McDonald's, killing it at the drive-thru.
Yeah, definitely.
And then what happens? Where do you end up next?
Well, it's kind of funny because I'm a vegetarian. So I've been a vegetarian all my life.
Oh my gosh.
And so I'm a vegetarian working at McDonald's in the drive-thru. And so that's
just right. Shoot everybody. Wow. So you could have the fries. You really could just have the fries.
I could pretty much, and at that time I don't think I could have the fries because they were fried in beef fat. But I could have the sundaes, and I ate plenty of sundaes.
Chocolate sundaes with the nuts are just those.
Yes, and this is before the peanut allergy, so we had lots of the nuts back then.
Yeah, why does everybody have a peanut allergy now? Because that was like my jam. That was the only time I don't like peanuts, but I could have it in this McDonald's chocolate sundae.
Especially that hot fudge sundae, for sure.
Good stuff. Wow. Okay, so you're in Seattle, and then how do you end up sitting next to me in New York City?
Well, I run a nonprofit called HealthTech for Medicaid, and we bring payers, providers, policymakers, and entrepreneurs together to scale and innovate in the Medicaid space. So basically what I do is I challenge an industry that was developed, and health technology was developed about 15, 17 years ago, but it was developed without any thought for communities that don't have the ability to pay. So it was made for people with discretionary income, and it was made for individuals with potentially commercial health insurance. So they have jobs, but not for anyone else. But the challenge with that is there's about 130 million people in this country that don't fall into those two categories. 75 million of which are on Medicaid. And so I really advocate for vulnerable populations. And the reason why we call our organization HealthTech for Medicaid is to put a frame around a large amount of vulnerable populations.
And so how does you get there?
Yeah,
I heard 3 degrees somewhere.
Yeah, so I have a pretty circuitous path. I'm an epidemiologist by training, and probably a very rare epidemiologist, right? Because I am very much a people person. So people person and data, all in the same bucket. And then I was a hospital administrator for the last 15 years, mainly in public hospital spaces, which can help with my love for vulnerable populations and communities. But I think I didn't realize how health equity and tech equity were equally
inequitable.
Yes. And I didn't realize how, I live in the heart of Silicon Valley, right? And so I was kind of on this angel investing journey and would see all these pitches from all these folks. There was very few diverse founders. And oftentimes these ideas were never going to go anywhere. It's like, I work in the hospital. This is never going to get through an IRB. This is never going to be a firm product. And so it just made me a little curious as to like, how does this investing model work? And how are these people getting all of this money? And so I started meeting with HealthTech CEOs, just asking questions. And the first thing I would ask people would be, so what do you do to serve vulnerable populations? And they would look at me like I had 3 heads. And so I couldn't figure out if it was because my name was Adimika or because I was talking about vulnerable populations or Medicaid, that they would get confused, or all 3, or both. But it really put me on a quest to really understand, so what is this industry and how have we allowed this to have no ethics, no competencies, no humanity? So that's why I'm here.
And so what you've created now essentially is...
It's a movement. It's a movement that in some ways really lights a fire under all of us, right? We look at very different stakeholders, policymakers, right, who make the laws and govern in states. Medicaid is a state-federal partnership, right? So it's done 56 different ways in this country. But at the end of the day, it houses 76 million lives, right? The people's quality and duration of life is dependent on this program. And that's people that are poor, genetically unlucky, or disabled, right? And it meets a big population in this country. 50% of the births in this country are Medicaid births. 48% of nursing home visits in this country are paid for by Medicaid. So it is cradle to grave for sure. Also payers, people who pay for care, investment in care. So that's managed care plans. That can be venture capitalists, people that pay into this system as a commodity. Providers, which I consider myself to be very much a part of. People who provide care every single day. They work in systems and clinics and hospitals, and they are a part of the care continuum and really thinking through how people get better care and better quality care. And then entrepreneurs, right? People that are coming in as early entrants into this space to disrupt this healthcare model that I think nobody in this country is happy with. And so I kind of hold everyone to task. How is it that we can right-size this tsunami that we've created in making sure that tech equity and health equity are not accessible to everyone?
And why do you think it is? I think, healthcare is, we're in an election year, so it's sort of health du jour. And I think there's a lot of misinformation out there about what actually is happening, what your benefits are. But at the end of the day, people just want to be able to go to the doctor and not have to spend more than their rent. How is it that, healthcare technology can actually help with some of that,
Sure,
so that you can make life a little bit better for people?
Well, you mentioned it's a voting year. It is. And I will say that the number one voting issue in this country is health on either side of the aisle, right? We all want to live healthy and productive lives. We want our children to live healthy and productive lives. We want our parents to live healthy and productive lives. And it has gotten to be a commodity that is so expensive that oftentimes we have to make concessions in order to do those things, to have and maintain the best health for yourself. For people who have discretionary income, they don't often think about the wellness things that they do to kind of reduce their stress, to increase their ability to look and feel great, right? And so I spend a lot of time really thinking about the disruption in health technology is really important. You have to have some productive tension in any industry to continue to change the way that we have traditionally done things. And so I think we have a ways to go. We have a ways to go on deciding that health is a right, and that health is a right for everyone. We also have a ways to go to really, there's these buzzwords, right, with Medicare for all. We have a Medicare for all system right now. It's Medicaid, right?
Why do people say that? That's the thing. I think the biggest problem with Medicaid is that it has a marketing problem. Like, the marketing person in me is like, because people do not realize that, like, that's what it is.
Yeah.
A couple episodes ago, I had Mahogany Phillips on, and she was a woman who got the laws changed so that you could get facial feminization surgery if you're trans.
Yep.
And she literally had to go to Albany to fight to get these laws changed because the idea of who is actually on Medicaid is not the reality. It's like someone on Medicaid could be someone like her who is like, just trying to live her life, has, somewhat of an income, but also needs to live. And so that's why you're on Medicaid. The world that it encompasses is so much more vast and diverse. And I feel that the problem is that people don't realize that it could be a regular startup founder who you think may have raised $1 million, but guess what? They still can't afford health insurance.
Many of them are. So I will say 1 in 5 Americans are on Medicaid. And you're right, it does have a marketing problem. And it starts with just the main words. If you think of Medicaid, aid, A-I-D, what does aid mean to you? It means, to provide help.
You're poor, you're brown. That's what it does. That's what it does.
And care, Medicare, means something completely different. Care means, we care for you.
Healthcare.
It sounds so much better. So it does have a marketing problem. But the reality is, many people, if 1 in 5 Americans are on this program, there are many people with plenty of resources who have a severely autistic child. And the person that is paying for their one-on-one aid in their classroom is Medicaid, right? So whether you have resources or you have no resources and you're living in a community where you have to use duct tape and dental floss and chicken wire to basically patch together your life from getting your kids from school to home, we always think about destitute, kind of like in Mississippi with no shoes, and that's the way Medicaid is. It's not that way at all. But I think that opening up the sieve and starting to really understand your neighbors and the needs that they have to keep their parents in the nursing home, or to care for a disabled child, or to deal with a traumatic situation when your husband gets into a tragic accident, all those people are on Medicaid.
And I think that's the thing that people don't realize, that if it is a fundamental marketing problem, and I think that's also people don't understand, because like this argument about what Medicare for all is going to be, it's like, well, it exists, it functions already. There are 100 million people on it. Yeah. So why don't we move everyone to Medicaid? Could that ever happen?
Well, I think in this country, there will always be choice. Right, because we live in a country of very big haves and have-nots. We have a huge, and so when you live in that that's a part of our history that is more than 400 years old in this country. So we will always have the ability for people who have resources to have better something, better care, better cars,
better to live,
all that. So, but yes, can we fundamentally put a baseline so that everyone who lives in this country has a commodity of health? We have to. Like, the economic development of this country is reliant upon people. It's reliant on us having productive citizens as children, and having people who are going to work for a living. That's how this country will continue to evolve. And so once people realize that one of those biggest commodities of economic development is health, we will be doing much better.
Well, yeah, I think I think it's got to be framed around the fact that it's healthcare justice. Because, when you think of what happens when someone is sick and how that ripples across so many different aspects of their life, where it's like, if you can't work because you're sick, means you don't have money, you can't pay rent, you lose your place to live, you end up on the street. Oh, wait, I'm on new services.
Yeah.
And like now I'm in a shelter, I'm more apt to get hurt, or I might end up in jail.
Sure. And
like everything kind of like falls off a cliff. And I don't think people realize that like that's why healthcare matters so much to people. In the entrepreneur world, like so many of us don't have health insurance.
Sure.
And it's like, okay, well, does that mean that I will be less of a risk friendly entrepreneur because I don't want to take the risk of doing something where I could get hurt, like going on a ski trip. Like, for example, like, and obviously there's a friend of mine, like, there was a ski trip that they could go to, and I was like, oh yeah, dude, go to the ski trip. And like, I can't ski. I was like, well, you just learn. If you're invited, you should take the invitation. And it's just like, well, if something happens and I get stuck somewhere, like, I haven't got the money. And I'm like, in that small microcosm, that kind of shows why it's healthcare justice. Because, okay, here's this entrepreneur that's invited to this private thing. They don't have to pay to go. But they're afraid to go because they're afraid of potentially getting sick or hurt.
Yeah.
And that person now no longer gets to be in a group of people who could potentially help build their business even more. Fund their business, be another partner, show that they're in these different circles of people. Like, it's...
But you're giving an example of, like, privilege. I mean, think of the people that, like, can't get from... the train to school, right? Or try to figure out how to, because they are concerned about their own ability, even with assistance or some help. There's co-pays, there's ability to have to pay into a system. And so it's a tough, I do think that we have to think about healthcare as a commodity. And I think the problem around entrepreneurs is a very interesting problem because some of the people that have created this industry of health technology being different have the mentality of what I call the lottery mentality. Like, they don't have healthcare themselves. They've created a business that is based upon those people with discretionary income or have commercial insurance. They're perpetuating the problem, but yet, they don't see it as, they look at it when I win the lottery, I'll give a little bit of money away. And I look at things from a community perspective, which is very different. If I have a little bit, I can give some of mine away.
Yeah, I think it's kind of nuts that, like, people don't understand that it attaches so many different paths. Like, I've got friends whose kids are on the spectrum, and, like, they're just good middle class people who live on Long Island.
Yeah.
And, like, for them, it's like if they don't get that one helper who can help their son, then he can't go to school.
Yeah.
It's like, it's kind of nuts, and I think that's the thing where it's like.
We're just gonna peek in, Laura. I'm sorry.
Yeah, that's right. I can. I'll edit it out.
Yeah, so as you see, larger scale, a little bit brighter just because of the positioning of my nose. So we're amazing chart. Thank you.
That's what editing's for.
I guess
so. It's like, and it's like. People, I often think that if people understood, like, why healthcare is a matter of life and death, that they would get it more. And I think, I see all these health tech startups that kind of pop out of nowhere, and I'm like, have you ever talked to someone who's sick?
Yeah.
Like, for real sick. Like, these people. Like, I've got a friend who has Crohn's, and I have been with her in the hospital multiple times, but for the fact that I have a very big mouth, and I happen to have a mom who was a nurse. Like, my mom was a nurse for 40 years before she retired.
My mom, nursing kids.
Although I'm terrified of hospitals and I hate blood. Like,
I have a grandmother and mother that were nurses.
Was they Caribbean?
No, but I married into a Caribbean family.
So that, like,
I didn't know.
All the women are nurses. But the one thing I learned from my mom was, like, you have to speak up and advocate for yourself.
Absolutely.
And so, like, whenever I go to the hospital with my friend, I'd be like, "What are you doing? Like, why is she not getting this medication? Like, who she is. She comes here, like, once a month because she has to get this treatment. Why are you treating her like she's, like, off the street? Like, this is absurd." And I think about that, and it's like, if you ever stood in an emergency room, how could you not use technology in smarter ways? Because there's so many things you could do. And instead, it's like, you're right, it's like this sort of lofty, perfected, all, like, white wall vision of, like, this, like, glooming place. It's amazing. It's like, no, healthcare is people are hurt, they need to be helped.
Yeah.
And how do you use technology in smarter ways?
Yeah, I mean, I've been on both sides of the coin there, and certainly a clinician myself. I will say that most people don't see problems unless they're very close to themselves. And so where I get empathy in talking to people about Medicaid, people are like, well, you're not on Medicaid, or you're, why do you care so much about this population? I always say to people, I'm like, 2 paychecks away from being homeless and about 1 paycheck away from being on Medicaid. So it's a very real thing for me. And I I think people don't get it until it's close enough to them. It's only when your 26-year-old kid gets off of your health insurance and, oh, by the way, the only thing that's available to them because they're they're an artist or they have different, and you don't have discretionary income to pay for their, $2,000 a month copay for their insurance premium, they go on Medicaid, right? And it's so fascinating for me that we don't think about things until you have a severely autistic child or until, you have a disability yourself, that you really need these programs, and that a safety net is there, and it's called a safety net for a reason, and we all have to pay into to making sure that we can provide the best environment for everyone. So I always look at it like I'm blessed. I know I'm educationally blessed, financially blessed. I have great and enriched relationships in my life, and those blessings not everyone has. And so it's my job to kind of make sure that I can do the best that I can to advocate for everyone
And
else.
so what's your journey been like? I'm gonna guess it has not been easy.
My journey? No, I mean, being a woman healthcare executive, they're a black female healthcare executive. There's just very
unicorns,
few, right? Like, it's beyond a unicorn, right? Like, you can count the majority of them on a few hands. And I think that in some ways was the impetus for me deciding to just break out and do something different. I've always had this kind of if now when philosophy, and if not me, who? Mm-hmm. And I learned for a long time by waiting for people to take up the mantle, that the mantle is there for me to pick up and take on. And so I do vacillate. I certainly have an ego and insecurities like everybody else, but I vacillate between, is what I'm doing now career derailing, or will it be, the launch pad for the remainder of my career defining? But if I die tomorrow, I want to feel like, and I want my kids to know that I did everything I could to realize a vision and to help make people's lives better every single day. So if I'm not doing something that's impacting people's lives, then there's no sense of me being here. I feel like that's what God put me on this earth to do. So everything I've ever done, even from my small drive-through experience, right, early in my career and life, it's really how do I impact the people around me as much as I can. And I realized that my community has just grown, right? My next job will have to be global, right? Because now I've got the U.S. kind of covered. But so I've just moved beyond having, it's this community in Northern California, this community in the state of California, this community in the U.S. And so we'll see what's next.
So your nonprofit is pretty amazing. You all just won something.
Yeah, we did. So we just won Nonprofit of the Year from Goldman Sachs, Fenwick & West, Rock Health, and Pacific Western Bank. It's a huge award at the Digital 50 in the middle of the JP Morgan Healthcare Week, which is the largest healthcare investing conference in the world. So it was shocking and also amazing, right? Because an opportunity for me to say to the industry, great, it's fabulous to have this recognition, but in order for this to have value, people have to write checks. People have to care about this just as much. This work is not done just on blood, sweat, and tears. It also requires dollars.
And so now that you guys have won the award, what is sort of next for you? Where do you want to take the nonprofit forward?
Yeah, so our vision in this upcoming year really is working with specific states, and so a part of me being in New York right now is actually kind of fleshing out that plan. In Medicaid, because it's a federal-state partnership, the way to make significant impact, specifically on the policymaker side, is to really work deeply in states so that, at the end of the year, I'd love to have something like we were able to impact X number of people's lives. That's the epidemiologist in me, versus having kind of just a movement around the country that kind of touts and builds up momentum. How can we actually go a little bit deeper and make that impact really count? So people on Medicaid do realize that innovation in Medicaid is a reality.
And are you often connecting the technology companies with people who could absolutely use it like today?
Yeah, absolutely. Every single day. We have 63 member companies, of which many are in New York. And we not only we connect them with payers who can bring manage Medicaid managed care plans who serve hundreds of thousands of people on a daily basis. In some ways, I feel like I'm a de facto kind of branding and communications agent for many people. But we also challenge the industry, too. Like, there are areas like maternal health, right, where our women are dying, Black women are dying, brown women are dying, right? And we don't have enough investment in that area. So we're also holding the industry to task around, if we're going to care about Medicaid, like, these are the areas where we need to start investing. And these are the areas that are oversaturated. Like, it's very easy to be a wearable company, right? Or it's very easy to be an app company. I mean, not also always easy depending on the industry. But it's very hard to tackle big problems that impact large amounts of people.
And are you all, and so, because we want to get you guys some more guidance or more money and more cash.
Sure.
How can people help? What's the thing that you're looking for next?
Yeah, I mean, write checks. No, write checks. I think opening up any relationships people have within states. It is an election year, and so I've said for every 1 million people on Medicaid, I want to be in that many living rooms this year to just explain to people what Medicaid is and why it's important. And so there's 75 million people on Medicaid, so I need 75 living rooms to be in this year. So if you know anybody with great living rooms and can bring a cadre of donors, leaders, community members, people, that's something I personally would like to do this year.
Awesome. So, okay. You live on the West Coast.
Yeah.
You have 11,000 jobs, as every Black woman does.
Yes,
it's kind of a thing with us, and we just can't help ourselves. What do you do to take care of Adimika? Like, is it go for a drink on a Thursday at 2? Is it go for a run, yoga, trap yoga? Watching Real Housewives, like, what is the thing that enables you? Because same deal. It's like, I think, we get so busy.
Yeah.
And we do so much. And I think oftentimes, like, with me, I know that, like, it's a lot that you have to give out in the world. And so, like, I need to, like, I'm going to be over here in the corner. Leave me alone.
Yeah.
So how do you manage that?
Well, I am definitely an extroverted introvert.
Same.
Which means that I've got a big personality. I definitely have but I have to recharge. So I would say the one thing that helps balance out my day is every day from 5 to 6, I work out. Like, I'm typically a runner.
Mm-hmm. Morning or evening?
Morning AM.
Oh, Jesus.
And so I usually take my East Coast calls starting at 9 o'clock. I've just gone through the drive-thru in Starbucks. They already know my triple campana.
What?
My drink of choice.
What is what?
A triple campana.
What the heck is that?
It's just espresso with a little bit of whipped cream. It's fabulous.
I've ever had one of those.
Oh, it's great. Yeah.
It's on the menu?
It is definitely. It's on the original Starbucks menu. I told you I'm from Seattle.
You're from Seattle. Like, you're like, no, I know.
Half the time if you go to someplace, I always trip, if I go to a new place, I always trip them up. They're like, where's that button at? But it's been there for 40 years. Starbucks been around.
Wow.
So I'm a runner. That's my clear my head. That also includes kind of my prayer time and my devotion time and my ability to really be grateful and thankful for the things that are in my life. And that humbleness is equally as important as the exertion of running. I also really love the outdoors. I have 2 young boys, and sometimes that's exhausting, other times it's exhilarating. But, I love to hike, and I love to be outside and breathe fresh air. And anything having to do with water is I'm an Aquarian, so this is appropriate coming in February. But so I think water is a soothing element for me. So sometimes it's running Lake Merritt, other times it's going to the beach, other times it's getting on a plane and going to someplace warm with a real beach, because our Northern California beaches aren't real beaches.
Those are fake beaches.
They're
rocky.
But yeah, and then I think the other thing is I spend a lot of time pouring into other people. I'm a mentor. I spend lots of time listening and trying to help lead other people's careers and lives, and that's really soul-fulfilling for me. And also just leaning on my sister friends. I have an incredible network of women around the country, around the world, from my line sisters to, colleagues.
So are you AKA a Delta?
I'm a Delta for sure.
Of course, I had a feeling.
Delta Sigma Theta for sure. So you got to be the activism, as I call the hacktivism now, data activism Delta. I think those are the things that kind of ground me. I have an incredible husband who's an amazing support, and we've been together a very, very long time, so he has seen me through all of my amazing rough patches, almost 24 years of being together.
But you're like 12, so
and almost 17 years of marriage. So,
wow, Black Rocks forever.
So he is certainly my rock and my ability to, when the world gets to be too much, I can scream and he'll listen.
Oh, fantastic. So, Adimika, it's been fantastic having you on the show.
Yeah, thank you.
And we could talk for more and more hours, because I am deeply interested in trying to help people get better healthcare, because I've seen it so many different places on where it's just like, this is just insanity, and I really admire what you're doing, and I want you to be successful. I want you to win, girl.
Me too. Let's do it. Let's do it together. Let's change and transform the way health is done in this country.
Because it's a right. It's
Agreed.
not a privilege.
Amazing.
So I will put all the information in the show notes about how people can get in contact with you, so you can donate or help you be in one of your 75 rooms. I guess you're claiming it now.
Yeah, I've claimed it. Now I've got 75 living rooms to get into.
in 2020, and I know that you're going to do it. So thank you so much for being on the show.
Yeah, thank you for having me.
And that is our show.